Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Anything.
Okay, good morning,
Good
Dr.
morning.
Mencia.
Good morning.
So
You and I.
Yes.
You and I
we're
against the
together.
world.
You
Always.
know, yeah, I love that song. You and I against the world. That's true. The weather has gotten much nicer now. Do you
Yes.
notice? And
We should tell the audience about the app because a
Yes.
lot of people,
Okay.
a lot of people have the iPhone,
yes,
right? And
Yes.
you can go into the App Store and you look for WSBR or WNN, and you can I just downloaded, so I was listening to you on the phone. It's so easy to, because when you go to the internet,
it's too hard to
it
first
is
find
too hard.
it.
A
And
lot
also,
of people like, I cannot get you. I opened the website, and then I said, now you have to press listen live and this and this. And so for those faithful listeners that we have, that they do a lot of traveling, there's an app now that you can download for WSBR.
So in other words, they just hit it, and then whatever's playing on WSBR at that time.
But you know,
they can
WSBR
listen.
belongs to a big corporation.
Yes, Beasley. Yes.
Right. So they have about 4 or 5 stations
Yes.
that they own. So once you download, you can look at all the other stations.
We don't want them to look at any other stations, just ours, please.
They can look at WNN because
Oh, at WNN's okay.
if they switch, they're going to listen to us
Both.
again.
Well, you can hear both.
We
That's
got
true.
Anita and Andy again.
This never stopped. You know, we're also on iHeartRadio. You don't even know that.
Oh, I
didn't
didn't
tell
know
you
that. No,
Yeah, we're
okay.
on iHeartRadio.
Yeah, I have iHeart app. I have it on
You
my
do.
phone.
Well, see, so you can have that too. Okay, so
Attention, listener from iHub.
so my question is, what is the disease of the week that you've noticed at your office?
It was very interesting. I have one of a patient that came to see me. His wife had been a patient of mine. They're from Canada. And he went to get his nail clipped. And when they are doing his pedicure, and it was so, I know the lady that does his pedicure, and she's been doing this for years. If there is a degree on this, she will be a doctor on manicure and pedicure. So she saw the person and said, I need you to go and see a doctor. This doesn't look right. And he felt that it was just a little infection between his little toes and the toes next to it. Mm-hmm. But in reality, there was redness going around. There was redness going around the dorsum or the upper part of the foot, of the left foot. So he came to the office and we looked, and I said, it could be gout. Or just so he'd say, no, well, the lady doing my pedicure, she's looking there, my wife looking between my toes, and she said, I have a fungal infection. And then I said, you do have a fungal infection, and you have cellulitis as a consequence of that. So it just so happened that I have the students with me, the nurse practitioner students with me. So it was a great teaching point. Because even when I first saw it, I said, it could be gout. But when they described to me, and then the lady that does the pedicure texted me and told me to look between the toes. And he told me he was, a good patient, a good historian. And he gave me the information. He has cellulitis already.
And I don't know what
crawling.
that is. What is cellulitis?
Is when the skin, the skin get infected. Now, you can get cellulitis because you have poor circulation, and that's the people you see with the leg, the bottom portion of their leg, including their feet, all red and warm, and usually get very hot, and it's painful. So when a person gets infection of the skin because of poor circulation, diabetic patient gets it a lot. When a person gets infection of the skin can basically break open and then expose the muscle. what was interesting on this person, and this is why I thought it was a very good case, what was interesting on him is that, and I was explaining this to the students in front of him. I asked him, do you mind if we do some teaching? He said, oh, no, by all means, I want to learn too. So when I was explaining to the student, the hands, and this is important for people to know, when you look at your hands, you're going to see that by your fingers, you don't have big muscles there. But how we can move the finger to do all this complicated maneuvers that we can do with the finger, like screwdriver or fix a watch, or those sort of things, and or do surgery, all of those things that we can do with the hands. So cut things, the thing that we can do with the hands is because the finger they have no muscle, they have tendons only. The muscles that belong to control the finger, they are in the arm up here. And some of them are by the hand. So when you have tendons going down, between tendons, you have a tunnel that will come and connect to the muscle on the forearm.
That makes sense.
Right. So a lot of times we get a little infection by the nail, or on the finger, we get a cut and it gets red. And we see that redness traveling toward the hand or toward the back portion of your feet, of the sole of your feet. When you see that redness traveling, that means it's going through one of those tunnels. And we tend to neglect it because, patients, a lot of them, they are not physicians or nurses, so they don't know. We tend to neglect it, but then we see by the forearm, we get the redness now coming up here, and we say, oh, what's going on? Do I have an allergy? And they go to the doctor. And now they have trouble, it requires big-time antibiotic to be treated. And sometimes we have to open the whole upper portion of the hand to get all the infection out of there.
My goodness.
So, the lady that does the pedicure, who I know for years, for probably since I've been here, for probably 18 years, and she is very well experienced. She right away said, go and see Dr. Mencia. I need you to, and she called, they text me, the wife text me and say, we need you to see, of course, the wife, my husband, and the lady, my client. And it was a true emergency. So my hat go off to both of them.
Wow.
Because, and it was localized. It was a localized infection. And I asked him, when did this start? He said, my wife noticed that last night. So the next day.
So there's no pain. When that's happening, there's no pain or anything?
At that moment, no. Eventually, if he would have let it go more than one day, it would have been so painful that he could not bear weight on that leg. So that, when he came, I asked him, are you able to walk? He said, yeah, fine. I just had that redness there, but I can walk. I can do everything. I don't have any symptoms.
So you really have to inspect yourself a lot, don't you, to see things that look a little bit different.
Right. And when you go for your manicure, your pedicure, go to a place that is clean, that they sterilize the instruments, and there's a lot of in South Florida and all over the world.
True.
Places that they use a thing from one client to the other client, and you can catch the most common thing that we catch is fungal infection of the nails.
Fungal infection of the nails. You see something advertised. You see terrible commercial on television about fungus on your nail. This woman's all dressed up. It's a very funny thing.
Oh yeah.
That's so bad. But what should people look for fungus in their nails? I mean, you see some people with all
you want to inspect
nails.
You want to inspect your nails, and you want to do it when you go for the ladies, when they go for the manicure and pedicure. When they take the color that you put on your nail, when you take that off, inspect your nails. And it should be very homogeneous. So the color should be basically the same. And when you press on your nail, it should blanch. And then when you let go, it turns red again. which means that you have good blood circulation under the nail. If you notice that your nail in one area is turning brownish, sometimes it's a light brown color, and sometimes when it's deeper, it's a dark brown color. The moment you see that, don't let it go, because if it's a small area, it will take over the entire nail. And it will lift it from the bend so that when you press it, try to blanch your nail, it won't blanch and then return back to red at the base of the nail. And you want to do the same thing with your feet.
See, now that's hard for someone to get to their feet up to them.
But when you're getting your pedicure, and they, for the lady, of course, they have the nail polish. They put that color to make it beautiful and what have you. When that color is off, take your time to inspect your nail. And people that are well trained in manicure and pedicure, that are very well trained, you can ask them any changes with my nail that I should be concerned with, that I need to see a podiatrist or my primary care doctor. And we have 2 podiatrists in the office that see patients. We even see patients on Saturday. And it's amazing to see how many young people, we tell them, you can see the podiatry. You have a little calluses. I have a guy that had a calluses on the sole of the feet toward the toes. Those are very painful. And he said, "Doctor, I don't know what to do. I've been doing all kind of things trying to get the pain off. It's there." I say, "It's a callus. We have to take it down. So I'm going to put you with a podiatrist." He said, "Well, how much is it going to cost me?" I said, "You have insurance. It's covered by your insurance." "Oh, I can see a podiatrist with of course." So a lot of people think a podiatrist is you pay extra. All the services that we have in the office, with the exception of the hypnotherapist, all the services that we have are usually basically just covered by insurance. So people, when it comes to preventive medicine, your feet are so important, because we brought both of the podiatrists, we have brought them to the show. And when your feet are not well taken care of, your weight distribution, which is when you stand erect, your weight distribution is supposed to be close to your heel, but toward the front, so that when you walk, you have enough cushion and you are not putting too much pressure on your small toes or your big toes of the middle where you get calluses. So when we develop calluses, it's usually 2 reasons. It's because the weight distribution had been shifted toward one side or the other, or the shoes that we wear are not proper. They are squeezing your feet too much. So when you go to the podiatry, a lot of times they will come and they say, wear this cushion, this cushion under your, the sole, so that the sole of your feet can redistribute your weight. And a lot of times when a person get a cushion, they say, it doesn't feel comfortable. I say it's not supposed to, because we're trying to bring your weight distribution back to where it belongs. It's like if you break an arm and we put a cast there, of course it doesn't feel comfortable. We're trying to put the bones together without doing surgery.
I think since we're talking about feet, I want to bring up a subject. I happen to have flip-flops on this morning, which I rarely do because I am going to go have a pedicure later, but they're not safe. Flip-flops are not safe.
Are not
we
safe.
ought to really talk about that.
And I know Dr. Joseph, always when she comes to the show, she talks about the fact that, even in the house, she say, we should try to wear. If you are like me, you are on your feet a lot, then you need comfortable shoes. And, I have the podiatrist, like once a month, just check my feet. Because, I put so much pressure on my feet. So once a month or sometimes, twice a month, she check my feet and make sure that I'm doing okay.
Yeah,
and it's all preventive. It's
right.
covered by my insurance, so why not? I'd rather do that than having to have something major that is going to cost me a lot, or my insurance a lot of money.
And this has nothing to do with people's feet, but dogs' feet. I know you had dogs.
Yeah.
How are they
And
able
horses.
to walk? How are they able to walk on all kinds of sidewalks and places, and their little toes? How do they? Is that a fair question to ask you?
No, it is a fair question because I do examine and I do look at your feet. Curiosity will teach us so much. The cushion that they have is so thick. If you look when you look at Snowy, look at Snowy, and look at that cushion that they have for the weight. How much? What's the weight on Snowy? Maybe
9.5 pounds.
9.5 pounds.
Right.
So for 10 pounds, for a 10-pound dog, that kind of cushion that Snowy probably had is more than sufficient for them to walk on grass and rock and anything. And the other thing is they don't have the innervation of nerve that we have. So they don't have all the sensation. Well, our feet are very sensitive. And if you notice, for those individuals that have no hands and they use their feet can become as important in doing anything, writing or painting.
Yeah, we've seen that.
We've seen that, right?
Yeah.
So those individuals can do that. And then why do we do that? When you look at the brain, and we map out the human body, most of the brain portion where sensation and fine control are in your feet and your hands. So we use most of the brain, it's not for our chest or our abdomen.
Feet and our hands.
It's our feet and our hand. And then come our face. That's why the face is so sensitive. So the feet and the hand are, when you look at the brain distribution, the feet and the hand take a big portion of the brain. So it's very sensitive. So a person can lose both hands, and you can train your feet to cook, to paint, to write, to type, to do all the kind of thing that we do with the hands.
That's true.
Yeah, we just don't appreciate our feet.
No, we really don't.
Discrimination.
No, but I have to tell you a funny story that people tend to be embarrassed about their feet.
Because they don't take care of them.
Let me tell you a sex story.
Okay.
I know.
Okay, Richard, get ready.
I was married for 18 years, and none of the lovemaking ever had anything to do with feet for me. I mean, with
you
my
missed such a big part.
He's my ex-husband now,
Oh, that's
but
why.
I started dating someone who loved to massage feet.
Very sexy.
Oh, my heavens, I loved it. I loved having my feet massaged. So that was my next question. There must be great... What happens to the feet? It goes right up to your genitals? I don't know.
It goes all over. It goes all over. That's a great question. Because, growing up in Hawaii, I have a lot of Asian influence in my developing. So if you look at acupressure, a lot of the acupressure that we do on patients, you can basically, remember we were talking about mapping the brain to the body? With acupressure and acupuncture, you can map the whole human body and all the internal organ on the sole of your feet. On the sole of your feet. So there's a portion that they can look at the liver, they can look at the thyroid, they can look at your sex organ. And
no, you're right, because the acupuncturists, they still tell you, well, you have a problem. I'm going to put this needle in over there because it affects your kidney or something.
Exactly. And, we have all the meridians. It's a different,
exactly.
For people that believe only on traditional medicine, they're going to forgive us for a second. We're going on a commercial break. Right. But when we're talking acupuncture of all the meridians that we have, all those meridians come and get connected. And it's interesting when, this Asian medicine have been practiced for thousands of years. So when it comes to traditional medicine, we're still in diapers.
Yeah.
We're still in diapers. There's a lot of things that we do because we do, but we don't know why we do it. There's a lot of medication that we take, that we spend a lot of money for them. And if you go on the internet and you look what is called mechanism of action, it says unknown. We don't know how this thing is working. And it's interesting because in order for the FDA to approve a drug, you have to compare that drug to some sort of placebo. Placebo is a sugar pill. And it's interesting when we present this drug to other doctors. I lecture to a lot of physicians. I'm a national speaker for a lot of pharmaceutical companies. And it's interesting when we present this drug, we say, well, with this drug, 45% of the patient responded, but the placebo, 32% of the placebo patients responded.
So it's the brain that takes over, right? I don't want to let this go. I get so involved with you, as you know, and I never say to people, if you've been listening to this charming physician, his name is Andy Mencia. It's actually Andres Mencia, but it's Mencia, but it's Andy Mencia, and of course he is the founder and the medical director of AGI Medical and Dental Centers. His home office is Fort Lauderdale on Commercial Boulevard, and he has a second office, which is Boynton Beach now. You can call for appointments. I'll give you the Commercial Boulevard phone number. It's 954-489-1345. 954-489-1345. And in Boynton Beach, it's 561-270-6494. Something very special about their practice is they do home visit services. Most people don't do that. They're also open on Saturdays. So, and you can hear Dr. Mencia. You can tell already that if you have a problem, go to him, and if he doesn't know what to do, he'll direct you to someone who does. Mm-hmm. But the nice thing, too, is he has highly trained specialists which work together to provide optimal cutting-edge patient care, and what you should know is Dr. Mencia will be one of our fantastic stars at our upcoming Cure Symposium on the 9th of April. And he's always fascinating. People just love I had a call the other day. Is Dr. Mencia going to be there? Yes, he's going to be there. As a matter of fact, Dr. Feinerman has just come in, and he will also be one of our stars. He's going to talk about stem cells. But, Dr. Mencia, the nice thing...
I was talking to a patient that was asking me about stem cells. So I sent him, and he lives in Wellington.
Really?
I sent him to Dr. Feinerman to...
Yes, well, the two of you have a lot in common, and it's...
We do.
It's because... You've always been on the cutting edge. I mean, from your, as you say, the Asian, living in Hawaii.
And he also living in Hawaii.
Yes, that's right.
So we have that in common.
That's true. Yeah, we know. You need, the microphone is not your head. But no, it's something about Hawaii that makes men so attractive. What is that? It's the coconuts.
It's something in the breeze, right?
The pineapple.
The pineapple, yeah. The papain in the pineapple decreases all.
Maybe we should do a double one day.
Yes, absolutely.
But it is great when people do come to you, Dr. Mencia. They do get tradition, but they also get all the other things that you've told people. I mean, I know I've been eating flax seeds. You told me that. It's helped me. I mean, I think I'm doing much better with that. I also, of course, am taking magnesium, and I take the vitamin D, which we get from you.
And I had a patient with a lot of bloating. I said, do the flaxseed. She loves it.
They're really quite tasty. Yeah. Mm-hmm. And I even have cereal with flaxseeds. But no, I take flaxseeds. I put it in most everything I have. But that's what I love about you. One of the most important things is you can look at the total holistic picture of people. And that's, and you can recommend people if you trust them to other things. And so you should be really proud of what you've become.
And
your parents would be very proud of you now, Dr. Mencia.
They're looking down and say,
I know.
Good boy.
Good boy. So everyone, please be sure to call them for an appointment. Dr. Mencia is rushing off in your splendor. Do you put a white coat on over this gorgeous outfit?
No. There's
no. He has a red velvet jacket on. I don't know why you're going to work today. You should be going out to play or do something. You play at your work, I know.
Yes.
It's great. Okay, well, I'm certainly...
Keep me out of trouble.
Yeah, well, you never keep out of trouble, but you do good trouble.
That's true.
You do good trouble, and we love it. And be sure to go to see the podiatrist at Dr. Mencia's. We've had a big discussion this morning on feet and what can happen. Just go and have a wonderful... she doesn't do a foot massage. She just does a pedicure, right? I mean, she just does a...
No, they
takes care
just
of
do
your
the
toes.
part, yeah.
Maybe we need to have now the foot massage.
That would
to
be...
think about that.
That would be really, really
Get one
cool.
of these Asian people to come in and then do the foot massage. Thank you, Dr. Mencia. It's always
Thank you for
wonderful
having
to
me.
have you. Yes, and we'll be seeing you very soon. And we're just going to take a break. We'll be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.